And welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena I call the wellness paradox. This paradox, as I view it, is the communication and interaction gap between fitness and wellness professionals and other allied health and medical professionals. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 25, we're joined by Dr. John Evans from Blend Health. John is a mental health professional, but specifically an ACT practitioner. Now, ACT might sound familiar to some of you listeners because we talked to Stephen Hayes, the founder of ACT, in episode 5. And we're going to refer back to that episode several times during this conversation. And if you're looking for a more in-depth discussion of ACT, please go back to that episode and listen to it. You probably can listen to this one first and then shoot yourself back to that one to get a little bit more deeper texture for the concept of ACT as a framework. But this conversation with John is specifically going to talk about how fitness and wellness professionals can use ACT, or acceptance and commitment training in the context that we're talking about it here, to work with patients and clients to better their outcome. Again, this is a psychological framework, and certainly what fitness and wellness professionals do has a psychological element to it that is appropriate within our scopes of practice. And John's going to talk about that during the podcast, but he's also going to talk about what to do when things start to get outside of our scope of practice and how to make that referral. This is an absolutely riveting conversation. ACT is a framework that I've used in my own life. I've used it with clients and patients, and I think it is incredibly transformative. We're going to look to share a lot of resources from this episode. Those can be found at the show notes page by going to wellnessparadoxpod.com/episode 25. I hope you enjoy this conversation with Dr. John Evans. I'm joined by my good friend, John Evans. John, thank you so much for joining us today.
Thanks, Mike. Happy to be here.
John and I have known each other for a couple of years now. And John and I were joking before we came on the air that he was supposed to be the first person to come on the Wellness Paradox to talk about ACT, which is what we're going to talk about today. But lo and behold, we got the founder of ACT, Stephen Hayes, to come to talk on episode 5. So we're circling back around with the second most brilliant person that I know regarding ACT to talk about it today.
Can't be mad about that. Yep, I appreciate that.
Well, John, I want to get right into our discussion by giving our listeners a little bit more of an understanding of your background, just to provide some context for the conversation. So why don't we start with that?
So I attended undergrad at Kalamazoo College, played soccer there. Very formative for me, whether it was relationships or competitiveness, and kind of just focusing on kind of the more mental aspects of all kinds of performance, academic and athletic. Went into psychology, got my master's at Western in counseling, was pretty, and this will come up when I talk about Blend a little bit, pretty disillusioned by the mental health field in general. Didn't love the diagnosis and kind of curative and fix you and pigeonhole you, and insurance and all that kind of sucked. And so pursued a different avenue still as a helping professional at the University of North Carolina at Greensboro in kinesiology, sport and performance psychology. So my doctorate is in that specialization of sport and performance psychology. Spent 7 years working with special operations at Fort Bragg, just training cognitive skills for performance, individuals, small teams, human engagement, conflict resolution, negotiation, shoot, move, communicate, all that fun stuff. And got a chance to just work with some of the most elite tactical performers really in the world. And, that really set me off on this path of focusing on a model that really maximizes human potential. And I think ACT does that.
Yeah, awesome. And I love your background. We've talked about this before. I love the fact that you actually got a doctorate that is psychology based, that was in a kinesiology program, which I think is very resonant to a lot of our listeners. And I also think that's why you and I have connected so well over the years.
Yeah. And I think that's actually an important distinction, because with that level or that type of training, I think I also got a chance to get at least a baseline understanding, an applied understanding of things like exercise physiology and biomechanics and motor learning and motor programs, and psychology of injury and injury rehabilitation, that is so important to working with athletes and performers. Like I can't help train a swimmer, a shooter, or whoever, without considering the idea of motor programs and biomechanics and all of those types of issues, nutrition. So I think that was a key component to the degree, is that yes, it's psychology based, but it's also based in movement sciences.
Yeah, absolutely. And then, as you said, you spent your time with the special operators, which is just an amazing, cool thought that was an opportunity that you had. And then you've transitioned to Blend. And just briefly talk a little bit about Blend, the mission of the organization, who it serves, and what you're doing right now.
Yeah, so Blend is an integrative mental health practice. Started out of Kalamazoo about 4 years ago. Just the CEO, Brooke Buys, just taking on individual clients, worked off referrals, started to expand, took on a couple of contractors, and really serves the people who aren't getting good service through general mental health channels. I mean, we really have gone a different direction on this idea of kind of a holistic model. Like if you need, nutrition, we have nutritionists. If you need, addiction specialists, eating disorder, suicide and ideation and prevention, performance, coaching, teams, individuals, groups, C-suite. I mean, we have that all within our organization to be able to provide, sometimes combined, where I would share a client, or we do group presentations and workshops, where we're bringing multiple degrees, multiple backgrounds, multiple levels of experience and expertise to each individualized client and group or team. So, we now serve people all across Michigan. I have clients, probably a quarter of my clients are outside of Michigan, West Coast, East Coast, Ohio, Illinois, and, working with all level of performers, mostly athletes and corporate and general population, especially during COVID, where people really started to kind of feel the burnout and languishing, and demotivation that kind of was a symptom of this pandemic.
Yeah. And I've always loved the integrative and holistic nature of the Blend practice. And as you said, you work with athletes, but you also work with the adult general population clients. And as a short anecdote, actually right prior to COVID, which the irony of this, I don't think is lost on either of us. We did I believe it was a 6-week workshop series on ACT for our adult general population clients at my fitness facilities that worked on the ACT skills. These weren't tip of the spear performers like you worked with at Fort Bragg. These weren't athletes. These were Sally soccer mom, Joe soccer dad, just looking to get a psychological advantage to make health behavior change. And you delivered that as seamlessly as I imagine you delivered things to athletes. And that's the cool thing about the Blend practice, but it's also the cool thing about ACT is that it has applications to such a wide range of populations.
Oh yeah. I mean, really, it was designed as a answer to, and we'll talk about this also, CBT, dealing with anxiety and depression, but also really great work in addiction and ADD and ADHD and just kind of general life lostness. And I think that's certainly been a huge issue of late.
Yeah. And let's get into acceptance and commitment therapy or acceptance and commitment training, depending on the context you put it in. And again, I mentioned this earlier. We really introduced this framework and we dove deep in episode 5 with Stephen Hayes, who's for all intents and purposes, the founder or the father of ACT. And if you want a really in-depth understanding of ACT, go back to that episode, replay it, listen to it. It was an amazing, amazing conversation. But I don't think we can have this discussion, which is talking about how fitness and wellness professionals can leverage ACT in their practice unless we level set a little bit and understand some of the foundational principles of ACT. So can you give us a little bit of just a brief review from episode 5 of the things that we should know about?
Yeah, sure. I'm not going to Steve was awesome. And I listened to it about 3 or 4 times. So definitely listen to that one, please. Don't take my word for it. But in general, I think the important things to know are that ACT at the end of the day is a behaviorism in that it's in that realm of therapy and intervention. We do care about thoughts and emotions. It's considered what we call the third wave of behaviorism. But ultimately, what ACT is trying to do is maximize human potential for a rich and meaningful life. And we do that starting with this foundational concept called psychological flexibility, which basically just means like the ability to act mindfully in pursuit of your values. And so to that end, there's a whole model with a fancy name, the hexaflex. But ultimately, I think what's most important is to understand that as it relates to thoughts and emotions, what we want to try to train people in, and I do mean train, right? This is a skill-based program. This is not a mindset. You don't just choose to do this. You have to train the brain to do this, because the brain honestly doesn't like a lot of this because its default is comfort. So what we talk about in terms of thoughts and emotions is that thoughts and emotions are information, not directions, right? So to that end, we also don't put any judgment on thoughts and emotions. A thought is neither positive or negative. A thought is we don't even really care whether a thought is true or false. We care about the workability of that thought or emotion, meaning, is it functional? Is it helpful or unhelpful in allowing you to pursue valued action? So I could have a negative thought like, John, you're lazy, but maybe that inspires me or like pushes me and it gives me the kick in the butt to go down and run on the treadmill or do my workout. If that's the case, then that negative thought just helped me pursue my values. And so this concern and this judgment over always having positive thoughts and thinking positively is, we let go of that hopeless, fruitless, very inconsistent pursuit of controlling those thoughts and emotions and simply choose instead what we want to pay attention to and focus on, because it's either helping us pursue our values or it's not. And so then the 6 key components really falling a lot within the mindfulness realm, and we can dive into those, but mostly it's this idea of know what matters, values, do what matters, commit to action, present moment connection, self as context, which is kind of an idea of like the fact that you can notice things and be an observer without thinking, and then diffusion and acceptance. Diffusion being the idea of distancing yourself and creating space from your thoughts as opposed to changing the content. And then acceptance, this idea of being able to accept that, like, I'm going to experience this whole range of human emotion. I cannot force myself to be happy or joyful or not anxious or depressed or sad. That's just an unrealistic pursuit. And so those are the main components. I think probably the most important to understand that it's all based around this philosophy of functional contextualism. Is this thought or emotion or action functional, helpful, workable in this context to pursue my values?
Yeah, great summary. And I get really jazzed up about this because I've used ACT for myself, and I've used ACT with clients and employees and people in my life. And it is such a workable framework. And I think that's the part, if there's anything to pin for people to take home, is, as you said, you don't care about good or bad from a thought or emotion standpoint. You don't care about true or false. You care about, is this workable? Does this help me lead the life I want to lead, or does it help me not lead the life that I want to lead? And I think that is probably what, if you distill it down to its core, would you agree that's the fundamental premise of ACT?
Yeah, I think yes, that's the fundamental premise, is that we're not concerned with changing, controlling, denying, escaping, avoiding thoughts and emotions. That takes a hell of a lot of energy.
Yeah.
Right. And I think anecdotally, like the true false thing, the example that I always use is, like, I was working with a soccer player and he came to me at halftime. This is a real story. And he said, John, I played a terrible first half. And I looked at him and said, yep, you sure did. Awful. It was bad. But is you focusing on that thought going to help you play a better second half? If not, if yes, then great. If you think that's going to help you with behavior change and motivate you and get you angry and that's going to be functional for playing, okay. I don't think it will. So regardless of the fact that it's true, it does not worth your attention. But this is where I think the ACT process takes so much skill building, is like you have to learn to control attention, which you actually can, not the thoughts and emotions.
Yeah. And that is the other thing. And I'm glad you said that, is that I feel like, and we're going to talk about CBT in a second, cognitive behavioral therapy. And I feel like there's a lot of very abstract concepts in the psychology world where when you start to talk about ACT, it is actually skill-based and attention. You and I were texting over the weekend on a podcast that I sent you from Amisha, if I pronounce that. Amishi Jha, and it was talking about the skill of training attention and focus and things like that. And it is such a skill. And I think that that's the exciting part about ACT, is that we're not asking people to go do something nebulous or abstract. We're actually asking them to build skills, just like shooting a free throw or bench pressing weight or whatever it might be. It is a skill-based endeavor. And I think that that is an incredibly empowering thought, that you can learn this kind of thing.
Oh yeah. I mean, I think, but it's, I feel like it's very empowering, right? And I think that what I have to do a lot of times is like, okay, we're going to do this in practice. Like this hour that we're spending together in the session is very important, but the 6.5 days or 7 days that we're going to be away from each other between is way more important. Because this whole process is a scaffolding process. Like I'm going to need to teach you the more advanced skill and more advanced skill. If you can't do this fundamental skill of moving attention from stuck in here to out here, then you're not going to be able to observe these thoughts and recognize, when you've got thoughts that are unhelpful and you're moving in an away value direction. So yeah, fully skill-based.
That's great. And what you said there about, hey, this is 1 hour a week. And what about the other 167 hours a week? It's the same thing that the personal trainers and the wellness coaches that are listening to this are thinking. It's great. Thank you for your 3 or 4 hours in the gym with me every week. But what are you doing the rest of your week that makes the difference? It's the same thing here.
And I love it. And that's usually my plug. And you say like the 3 or 4 hours, like all I'm asking for is like 3 to 8 minutes a day. Like that's what I'm asking.
Yeah.
Like that's the commitment. But 3 to 8 minutes, 10 minutes, maybe a day. And we can get to this kind of this outcome of attention control and being able to focus on valued action and recognize thoughts and emotions that are driving me away from my values and so forth. So, yeah,
we could keep talking on ACT at great length, but we need to keep drilling down here for us to get to the topic of this conversation, which is how fitness and wellness professionals can use this. I think to build the bridge to that, we have to talk about cognitive behavioral therapy, because this is kind of viewed as like the gold standard. We've all heard the Noom commercials where it uses a cognitive behavioral approach. And I think there's a two-part question here. One, how does ACT differ from CBT? And then secondly, why have you came to ascribe to the ACT philosophy versus the CBT philosophy that was probably more frequently taught for you when you were in school?
Oh, yeah. I mean, we all learn CBT, and it is the gold standard in terms of what's being practiced. I'm going to try and do this in the most unbiased way I can. And I think that the analogy that I use really like kind of tells the story, and then I can expand from it. CBT is like you're in a rowboat and a storm comes. And as your therapist, I teach you coping mechanisms and strategies to row yourself out of the storm. So now I'm rowing and I'm rowing and I'm rowing. And I could be could be a big storm, could be a little storm. So I don't know, but I'm rowing and rowing until I get clear of the storm. And maybe I do, but like I've expended so much energy to get out of that storm that I no longer have the energy for valued action or for pursuing and living a meaningful life and feeling fulfilled. And then guess what? Another storm is going to come. And then I got to harness whatever energy I have left and row out of that storm. And so the point is always to avoid discomfort, to get away from the storm. Whereas in ACT, you're in your rowboat. I can still teach you. I'm going to teach you some skills to kind of maneuver around with your oars, but more to just balance in the boat and know that like storms are going to come and storms are going to pass, but I can balance in this boat and conserve the vast majority of my energy for living my values and making valued decisions and acting in ways that move me and push me toward those values, regardless of my thoughts and emotions and situations and life circumstances. I mean, just think of COVID. Like, I don't have to, I'm not going to get clear of it. I have to learn how to thrive and live in it and do that in creative ways, psychological flexibility, instead of like trying to escape it or pretend like it doesn't exist or change it or have this, you know, this idea of like, and I love the concept of toxic positivity and like really dislike all the shirts and memes with good vibes only. It's like, no, that's not real. That's not real life. And so ACT differs in the control aspect and the need to get clear of the storm and avoid it and change it and escape it, as opposed to just saying, okay, yeah, you know, today I'm feeling a little anxious and sad, but you know what? I can still go run on the treadmill or go to the gym. I can still work on my connection and relationship with my son and my wife. And I can still, you know, go run some errands. I can do all those things despite feeling anxiety and sadness or anger or whatever. And so I think that's the fundamental difference, is that ACT or CBT is about control and changing the content of thoughts and emotions. So if I just did something, yelled at my kid, and I think, oh, I'm a bad dad. And I think CBT would tell me, no, tell yourself you're a great dad. And to me, that just avoids the problem. Maybe in that moment I was a bad dad. Like maybe recognizing that I made a bad decision is going to help me change. So I can't avoid that thought. I don't want to change the content. I don't want to get stuck on it so that I just believe overall that I'm a bad father, but I do need to reflect on it and say, okay, my brain just provided the information that I'm a bad dad. Maybe that means it doesn't align with my values, what I just did, and I need to make a change. So I think ACT is just a much more sustainable, long-term solution to life, to living a rich and meaningful life, experiencing the whole range of human emotions and thoughts, positive, negative, and good and bad and true and false, as opposed to like constantly trying to like put the Band-Aid on and put the tourniquet on and like change the content of the thought and, I don't know, deceive myself or like fake it till I make it. That's the big military push. But that would be the fundamental differences for me.
That's great. And you really answered the second part in that, which is why you ascribe to the ACT philosophy. Is it's more pragmatic and, you know, dare I say, based upon your professional experience, it's been more effective in your practice.
And, you know, without really knowing it, like this is how I practiced ACT without knowing it when I played soccer at Kalamazoo. Like anger, most people would say, is a negative emotion. Like, no, you don't want to play. You don't want to be angry. You don't want to be anxious before games. Like I was super nervous before games, and I played with an anxiety and an anger that actually was super facilitative for my performance. Mm-hmm. You know, everybody talks about John McEnroe about, oh, he was out of control, and yeah, he was the antics and the screen. Yeah, yes, but that emotional state, I believe, was facilitative for his performance. And so who's to say that was those are negative emotions? I mean, he was a great role model for kids, you know, probably not, probably could have done some things a little differently, but ultimately, like an emotion is just an emotion. If I allow that emotion to dictate my behavior and I get a red card or I yell at the ref or I yell at a teammate, I berate them. Now I got to figure something out. But the emotion of anger is very energy providing. And from a physiological standpoint, like I want that sympathetic response. I want that flood of adrenaline and cortisol during a soccer game. I don't want to try and suppress it and feel relaxed. And that doesn't make any sense to me.
Yeah, I love it. And ACT is great for metaphors and analogy. Your rowboat analogy and metaphor there, I think, was great. There's a whole host of other ones. We'll link up to some ACT resources on the show notes page. We'll link back to the Stephen Hayes podcast as well as some other things. Well, let's keep drilling down here, John, because this is a podcast for fitness and wellness professionals. And the question becomes, how can fitness and wellness professionals use the ACT framework with their clients and patients within the scope of their practice, because that's critically important here. None of us are who do this for a living. We're not trained clinical psychologists like you and your colleagues are. So how do we put some guardrails on this to use this really powerful framework to help the people that we serve?
Yeah, that's a fantastic question. And I think I boiled it all down to 2 or 3 things, right? The first one is like, and I mean, as an actician, this is certainly the way I feel, but as a sports psychology professional, sports psychology has hung its hat on imagery and goal setting for about the eternity of the field. Other things, but like if you boil it all down. And so I think the first thing is that like goals are great. I love goals. But there's a few things about goals that I think fall short or don't get you to the finish line very well. And that is that goals are in the future. I don't care if it's 5 minutes from now or 5 years from now, goals live in the future, right? If I want to be able to control my attention and stay present and mindful, then goals are not a good way to do that. There's also a certain aspect of goals, especially health and wellness goals, that are not within my control. Like, yeah, I want to weigh 180 pounds again and be like as fit as I was in college. Great. Like, I don't know that I control that, right? I can't make myself lose weight in a healthy way. And I think the focus, this laser focus on goal attainment and achieving goals actually starts to set you up for what we call the success trap. Right. Okay. So maybe I do reach this weight goal. Well, then that's something that then like, ooh, I popped the cork on the champagne and then it's off to the next goal. Or if I don't reach it and that's all I'm focused on, worse. Now I'm devastated. And so this idea of shifting the focus and that spotlight away from goals and onto values, right? Because values are what underlie or should underlie your goals. Values, unlike goals, live in the present. I can act in a way that meets my goal of connection and adventure and competition every day. And I control behaving in ways that align with those. So if I can focus every day that I go to the gym or every week on just behaving and aligning behavior with my values, now I've got a way to enjoy the process, the journey, while still focusing on the destination. I'm never going to be a guy who's like, no, it's not about the destination. It's about the destination. The wellness goal is important. The life financial goal is important. The relationship goal, the family goal is important. But I might as well focus on what I can do to get myself moving in that direction every day. So from a geographical standpoint, if San Francisco is my goal, like I can't make myself get there right now. I cannot get to San Francisco in the next hour. I might be able to buy a flight for $2,000 and try to get there by tomorrow. But I can stand up and walk a mile to the west or get in my car and drive 100 miles west. Like I know I can do those things. And so by moving the focus away from that goal attainment almost completely, you know what? Not completely. Put it on a Post-it note, stick it on the wall. There's your goal. But every day it's about how do I act and behave in ways that align with my values that are connected to that goal. Now I've got something every day that I can control and I can push myself toward. And the bottom line with this one is that there is every bit of research, and it is true that goals provide motivation. But motivation is simply the desire to do something. Values provide the commitment to action of actually doing it. And I think that is the fundamental difference that values provide that goals do not. And I think that's where, personal trainers, athletic trainers, fitness professionals of all kinds can really kind of move that needle from all this goal attainment stuff and goal achievement to valued action. What are my values and how do I act in ways that align with those values? So that's the first one.
I love it. Goals provide the motivation, but values provide the committed action. That is a take-home message.
Yeah, and I think, and that is just something that, and it's not just John's opinion, right? There's a lot of evidence-based research in ACT that provides for that. I mean, even and I get a lot of my information from the Weight Escape, that the book by Russ Harris and others on kind of wellness and fitness. But so that is a huge, for me is a huge, that's like probably the number one. The number two is, and it probably combines with the third one, is really like ACT is about validating and normalizing discomfort, right? Going to the gym and doing a 2-hour workout is not overly comfortable or easy, right? And again, back to the CBT questions, like CBT would be like, no, tell yourself it's fun. Tell yourself that it's easy. Tell yourself that like you can do it. You know, all these like positive self-affirmations. It's not fun. Like there are workouts that are not fun. I run on the treadmill 4 or 5 days a week and I hate running. But you know what? I get down there, I find the ways to do it in the way that make it the most enjoyable for me. And then afterwards, I'm like, damn, that was awesome. I'm so glad I made myself do that. But still not fun. I didn't like want to. I don't know that I still want to. So I think the other thing is like this like idea of validating, normalizing discomfort, understanding like it's supposed to be difficult. You know, that part of the ACT model is that's where it's like experiential acceptance is, hey, I have to be able to endure the short-term discomfort that comes from valued action. Because I think that's part of the values work is there is some great short-term comfort that comes from moving away from my values a lot of times, right? Deciding to go sit on the couch and eat a bag of chips instead of going to work out. There's a lot of comfort right there. But ultimately that, I guarantee anybody listening to this is like, if you've done that and you have, that short-term comfort is exactly that, short-lived. And then you're like, what the hell did I just do? Tomorrow I'll do it right. No, but now the brain is like really synced in with this short-term comfort. So the other thing is like validating and normalizing the discomfort, normalizing the difficulty of eating healthily and becoming fit. There's a challenge there. And I think so then the connection there is the mindfulness piece. And everybody talks about mindfulness, but the way I just boil mindfulness down to living in the present non-judgmentally, right? And that's a key, the non-judgmental piece. Part of psychological flexibility is like, there's this cool term in the Weight Escape called urge surfing. And it's like, look, I can notice these urges and cravings and stuff. And then I just need to like notice them, kind of wave at them as they pass by and let them surf on by and then focus on a valued action. So I need to observe it and notice it in I'm going to have cravings. And we're going to have thoughts that are going to try and push us toward comfort. But I think the more we can be noticers and observers of those things and not try to like convince ourselves that we're not having the craving. And that's a lot of energy again that goes into that. So I think this idea of like just practicing some level of mindfulness, whether that's more formal or, you know, intuitive eating and mindful eating or yoga or just something informal, like 5 minutes a day where you're just kind of noticing the act of brushing your teeth, is getting you into this model of like focusing in the present in a non-judgmental way. And I think the judgment and the self-compassion, which is another component of ACT, is essential to this process. Because you're gonna have a piece of chocolate cake at some point. You're gonna eat half a pizza. Like, okay, fine. But can you recognize that, observe it, and not then get stuck on it and no, I'm a failure and I have no willpower and I'm lazy, and now that just drags you down the wrong direction. So I think that piece is also another important piece.
Yeah. And this is where this becomes so powerful, because I've been a fitness and exercise professional for 23 years. And I can't tell you how many people have came to me and said, I'm just not an exerciser. I just don't like to exercise.
That's a narrative, right?
Yeah. I just don't enjoy it like you do. And for most of my career, until I found ACT, I was always trying to come up with creative ways to cognitively restructure that thought for them. And it was exhausting for me as the professional. I could only imagine what it was like in their mind. And ACT just gives you such a different lens to view things through.
Yeah. I mean, it fully gets you just accepting that you're going to have all the potentially constantly thoughts that try to drive you away from that fitness, that level of fitness, and that until it becomes truly a habit. And you may still not find it fun, but I find a big difference between fun and enjoyment. Right? Soccer practice was very, well, sometimes fun, but not often fun. But at the end or during it, I remember thinking, God bless it, I'm enjoying myself. And just being able to like be there and in the pain that came with it, and the bruises and bumps and blood and discourse, like all of that is part of the process. And if you can accept that that's part of what's bringing me toward my value of competition and connection and adventure and support and leadership, like, man, then it's worth it.
Yeah. Man, there's so many different places to take this, and we can, this discussion keep going on and on and on. But I think it's also important that we touch really quickly if fitness and wellness professionals are going to use this. And I think the three areas that you mentioned are the most logical entry points. I think they're also going to realize, and maybe because they're using ACT or just because they're attuned with their clients or their patients, that there may be some deeper pathology that exists psychologically where they do need a referral to a licensed mental health professional such as yourself or the team at Blend. Talk for a little bit about maybe some of the warning signs for that, and then possibly how to facilitate the referral process.
Yeah, so I thought about this one too. So I think the number one, and it's just, I mean, maybe it's obvious, but like just absence. Like if they're getting themselves into the gym, then something is committing them to that action, right? Not that that's to say that they still don't, there's not a red flag or there's no referral needed, but like real just absence is really probably the number one indicator. But then I think it's about pervasiveness. Right. If they're coming to the gym and they're like, oh, I'm not motivated to work out, or I just feel like I'm late, and it's in the realm of exercise, probably something that you can manage with some values and some commitment and some motivation. And but if that is starting to like, I work with a hockey player right now, and he's like, it's not just hockey that he's talking about. He's like, I don't enjoy anything. Like nothing has flavor or color or excitement for me anymore. Not school, not hanging out with friends, not football, not hockey, nothing. And that's like where it starts to become pervasive and kind of go outside just the realm of fitness. I think that's another indicator, whether it's relationships or occupational or social or financial. They start talking about like got laid off, or like I'm getting divorced, I'm having issues at home, or they start talking about like using alcohol or some other substance to kind of that, like they need it to kind of unwind. Those are probably indicators that something else is going on, and it's not just like this kind of lazy, not wanting to come to the gym and not wanting to get fit. So I think the pervasiveness is probably the main factor.
Yeah, I think that's very insightful. And certainly this requires knowing your client or patient fairly well. It absolutely requires having a good relationship with them, because this is a touchy subject to bring up. And then it also requires having resources to be able to refer out to in your network. I'm very grateful to have you and Brooke and the team at Blend and other people that we can refer out to. And I've cultivated that over time. I guess the question that comes up out of that is, what are your thoughts on actually the physical facilitation of that referral process? Like for you as a mental health professional, how does that work best? What, I guess, best practices can you give some of the fitness and wellness professionals about making a good referral?
I mean, I think that honestly, I'll just be honest. I think you guys have the gold standard. Like have a partner that they can access, that clinicians and trainers can access, and members of your gym or of your organization can access on the website, and just say, hey, here's a whole other partner that we partner with, understanding that like mental health and wellness and emotional stability and happiness and whatever is like a huge part of you being able to kind of continue on this journey. I mean, just like you would have a nutritionist or, occupational therapists or whatever people, other resources, like partnering, have a partner. Short of that, like at least have like the list of resources available for the more old school people, like physical pamphlets in the space. But for for younger people, I think the website and having those resources available. I think the other thing is like bring somebody in, like have them do like a PD with your staff at the very least. If not, just like a free kind of, or just an informational, like, hey, here's some of the things we're dealing with right now through the pandemic, or, oh, it's December and it's coming around, the holidays are coming and resolutions. That's when we started art, right? That's when we did the Unstuck series, is like, well, we got this coming up, and people are going to start making their resolutions. And so timing it with times of year or specific dates that might kind of promote mental health or promote some issues and struggles with mental health. So that's what I would say, is like definitely have like at least a partner or some referrals on the website, have physical stuff, but bring somebody in to kind of talk to staff on how to recognize those red flags, on how to use language. One of the things I love about ACT is like the use of language. Mm-hmm. Right. And so you get these exercisers who are in there and you might get frustrated because they can't get through a whole series of whatever in the fitness solutions class, and you see them getting frustrated. Like the inclination is to say what to that person? Don't get frustrated. Don't get frustrated. Just stop being frustrated. Well, that honestly, for most people, and when I tell my wife to stop being anxious, I know how that goes. And so I think just learning to talk, to use language to promote like action and the normalization of feeling frustrated, and any other kind of those language-based interventions, and just vocabulary I think is super important.
Yeah. Well, you said it. It's about developing those relationships. And that's been a theme throughout this entire podcast series, is that it's reaching out and developing external relationships with other allied health professionals to create an integrative, holistic care team. And we can't stay siloed. We can't stay in the four walls of our facility or just on our own Zoom screen. And maybe you don't have to go to the significant lengths that we've done, putting you on the website and things like that. But to your point, at least have someone who can come in and talk to your team so you could understand these kind of things. And from there, be able to facilitate the referral, if nothing else, with a business card or something like that. It is about creating the relationship.
And I think the other thing I'll say is that there is a tendency, and you brought this up when you asked the question, which is great, is like within the bounds of my practice, right? Of my expertise as a fitness professional. And I think one of the things that we've seen, and I'm sure it goes both ways, is, I've talked to a number of physical therapists who have told me 75% of the work that I do with my clients is between the ears. And I'm thinking like, what are you doing, guy? Like what's happening? Please know that like we exist, we are out there, and we can be helpful. Like, I'm sure you do not want me giving your client like range of motion exercises after ACL surgery and telling them like exactly how to, what medications to take and how to do the exercises and how often, and prescribing that kind of stuff. So there definitely is like an understanding that like, yes, maybe you grew up as an athlete, or what it's like to be mentally tough, or resilient, or have, whatever. But please understand that there are resources that are specifically trained to do this kind of thing.
Yeah, that's a great anecdote there, because I think a lot of personal trainers will say that they feel like they're a psychologist most of the time. Yeah. And I don't want my psychologist periodizing an athlete to peak for nationals no more than the psychologist would want the trainer to have a conversation around psychological flexibility with somebody who had an anxiety disorder. And I think that is a very, very good story that has a lot of application to our field.
Mm-hmm. Yeah. And I think that's where the collaboration comes in. We have business relationships with you guys and some yoga studios, and just the idea that we have these resources and they're out there, and we can start to collaborate and and work together on these things and do workshops together and do information psychoed together is so just I cannot overstate the importance of that process.
Yeah. And not to belabor this point too much, and I think we'll just leave it at this, is that it actually greatly unburdens my team of fitness professionals when they have the ability to refer out to someone who can work in the psychology scope of practice, because that's not what they're trained in. They're great exercise and fitness professionals. That's a very efficient thing for them to do. As soon as they start to try to help somebody with psychological pain, discomfort, pathology, that's going to be a very cumbersome and laborious process that on a business level, we're not getting compensated for. On a professional level, we're not qualified for. So this not only does it have implications towards, patient and client care and positive outcomes, but there's also a very real business implication to this as well.
Yeah. Yeah. And I mean, we talk to our we talk to our own clinicians about this. Like, look, and even within psychology fields, like, look, if you don't feel comfortable working with addiction or eating disorders or suicidal ideation or any number of the other psychopathologies, like, we have a whole team even within Blend that will take over, or at least, co-author a treatment plan for this person. And, I think there's a certain level of what I like to call ego suspension involved in that. It's like this ability to look, no, I still have an ego. I'm still an expert at things, but I'm going to suspend that ego in areas where, I don't really thrive or I'm interested or feel like it's going to be productive.
Yeah, great. Ego suspension. I feel like we can go off on a whole conversation about that, but we're coming close to time here. And you mentioned the idea of there being resources out there, and clearly Blend, you, Brooke, your team, you guys are resources. Where can people go if they want to find out more about you?
So our website is www.blendhealth.com, and Blend is spelled this way without an E. We have an Instagram account at Blend Health. Happy to provide my personal email address and even and phone number. People can reach out. We get so many kind of word of mouth referrals now, but I think our website is actually quite good and quite robust. And it's just as kind of as you can check out our whole therapist team, what our specialties are, educational backgrounds, offerings to teams, individuals, groups that we run, psychoed workshops. We're actually starting our own. We're doing retreats now. We're going to do a retreat next year that I'm pretty excited about. So check out the website. There's always offerings. There's always a way to get a free consultation and talk to somebody, whether it's simply a matter of I just want to do life better in some area, or that this over the last 2 years, a minor kind of discomfort and kind of mental health issue has really blossomed because of your inability to kind of pursue goals and relationship, financial, occupational, social. And so, www.blendhealth.com is all you really need.
Awesome. Well, I will link up to that in the show notes, certainly. We'll also link up to, as I said, episode 5 with Stephen Hayes. You mentioned The Weight Escape, which for those of you that are listening, you didn't see John put that up on the screen. It's an outstanding book. It's an ACT-based approach to weight loss. I think there's a lot of the applied principles as it relates to the fitness, nutrition, and weight loss realm that might connect some of the dots to what John said today. I'll link up to all of that in the show notes page. And John, this has been a great conversation. This is something I'm very passionate about. We can go on talking for hours, but we're going to wrap this up with our final question, which is the real elemental reason that this podcast exists, is that I view the wellness paradox as the communication and interaction gap between fitness and wellness professionals and other allied health professionals, have it be mental health professionals such as yourself, doctors, other people in the medical community. If you can give fitness and wellness professionals one piece of advice to close off that gap, what would it be?
I think, I have to go back to values equaling commitment over goals equaling motivation. Everybody, our culture, our society is so damn goal focused and oriented. And when we don't achieve those goals, the demotivation that occurs, the self-esteem, the identity crisis that people have is horrible. Yeah. So the ability to be able to talk to a patient, a client, somebody at your gym, and talk to them in a way that commits them to action of something that they value and that they care about. Just as an anecdote, like fitness and wellness is not a personal, and health is not a personal value of mine. Just not. Mm-hmm. But competition is. So I can find tons of ways to, even in my own household, like keep a chart of like how many miles I've run versus my wife and be able to put that in her face every week. Or, another number one value of mine, connection with my son. I want to be able to play soccer with my kid when he's, when I'm 60. I'm not going to be able to do that if I'm totally out of shape and my muscles have deteriorated, my bones are brittle. So the idea of keeping in shape and staying fit and being healthy, because I want to be able to kind of blossom through that that connection with my son and still be competitive and be able to live my life of adventure. That's how I connect myself with. And so finding whatever that person's is, like most people don't have health or fitness or wellness as a value, guaranteed, but they've got something, perseverance or courage or connection or adventure or whatever it is, competition, let's connect it to those things. And then I think that we can lessen that gap.
Love it. John Evans, thank you so much for joining us.
Thanks, Mike. I love it. I'm happy to follow Stephen Hayes and talk more about the fitness and wellness aspect of ACT, but I appreciate you having me on. I always love doing this.
Well, I hope you enjoyed that conversation with John as much as I did. If you found it insightful and valuable, please share with your friends and colleagues. Those shares really do make a difference. Any of the resources that we talked about sharing can be found on the show notes page by going to wellnessparadoxpod.com/episode 25. Please be on the lookout for next week's episode when it drops on Wednesday. And don't forget to subscribe through your favorite podcast platform. Until we chat again, please be well.